Okay, so now we're discussing the impact of culture on health. We know that culture impacts health. Now we're going to talk about the how and what we can do about it. So, culture impacts every aspect of human behavior, including their beliefs about health and their health behaviors, their practices. Perceptions of disease and illness differ around the world. People from high income countries may use the Western paradigm of disease. They're always looking for a scientific cause of illness, whether that cause is genetics or microbial infection or injury or exposure to carcinogens or health behaviors. Now, whether they attribute the right cause to the right disease, that's always questionable, and sometimes you have to clarify some misconceptions. But there is that orientation towards a scientific cause of illness. People in low and middle income countries may view disease as being caused by other factors, like an imbalance of the body. Hot and cold is one popular theory in different cultures. Yin yang, if you have an imbalance of those, you will become ill. And so there's emphasis on hot foods for certain illnesses or conditions, and cold foods for certain illnesses or conditions, and things that can balance out the body. So treatments are geared toward that. Some cultures may believe in supernatural causes, and you even hear this from very Western people, like this is God's punishment. Um, but there are cultures that subscribe to theories of witchcraft, evil spirits, and the evil eye is a very popular belief in a few cultures. It's caused by jealousy. So you might see a little red bracelet around the baby's wrist, or an amulet like this child in the picture is wearing to protect the child from the jealousy of others. Um, Punishment for sins is a popular one. That people believe infertility in particular can be punishment for adultery. You see that in some cultures. And there are cultures who have folk illnesses or what's called culture bound syndromes. An example of this that I've given you is called cysto. And cysto mimics the symptoms of depression, but it's thought to be like a spiritual attack or a serious trauma, emotional trauma, or witnessing the trauma of others. And it involves anxiety or nervous kind of predisposition, lack of appetite, insomnia, palpitations, fatigue, and depressed mood. And where in Western culture, we might think, well, that's an imbalance of serotonin and dopamine. In a traditional culture, they may say that this was caused by a spiritual attack. And so instead of an SSRI or other antidepressant, the family may encourage the individual to seek care from a traditional healer, who would then prescribe herbs or have a ceremony, or sometimes there's prayer involved. And this is kind of common in Latin American countries, cysto. But there are other culture-bound syndromes that belong to other cultures. Health-seeking behaviors and patterns of resort. So people generally start with what they know, the most familiar and the cheapest and the simplest treatments that are available to them. And that is across the world, that is across cultures. Cost of care and burden of accessing it are major considerations. People with health insurance can access one level of care, people without it can't access that. And generally, people will progress to more invasive or more expensive or more unfamiliar treatments as a last resort. So to compare different cultures, let's say that we have a patient in the United States who is United States born and raised, and that man hurts his back. He's going to start with self-care, maybe a warm compress, maybe stretching exercises, maybe getting in the hot shower, maybe laying down in a position that takes the pressure off his back. If that doesn't work, that person might go to over-the-counter meds like acetaminophen and ibuprofen. If that doesn't work, they'll go to their doctor, their primary care provider. And if that primary care provider can't help them, they might seek a higher level of care. They might go to more specialized care, like a chiropractor or an orthopedic surgeon or pain management clinic. And sometimes when all else fails, that individual will go to a complementary or alternative medicine. In this culture, it's common to see people using CBD oil or even medicinal marijuana, but they might also use things like biofeedback, acupuncture, acupressure, Reiki, a number of treatments. In a traditional society, it's a little bit different. They don't have the same access. So they may use herbs or food-based cures. They might even have access to a pharmacy that you walk into without a prescription and they get whatever medication the pharmacist tells them is good. Then they might seek the treatment of an indigenous healer, as this woman from the Philippines is doing. And then they might go to Western medicine if all else fails. And Dolgi was a very good example of that. He tried self-treating, and when that didn't work, he went to an indigenous healer, and when that didn't work, he went to Western medicine. So health behaviors and health behavior change. This is sort of where we are as nurses. How are we going to influence health behaviors? Many times cultural practices are important to an individual, and we don't necessarily want to change. We want to adapt our practice to accommodate them, but sometimes they pose risk or they actually cause disease. So let's consider the global burden of disease. A lot of risk factors for your DALYs and your death rates are rooted in health behaviors. Health behaviors like seeking immunization, health behaviors like tobacco smoking, health behaviors like overeating or having a sedentary lifestyle or having a high level of stress. Culture a lot of times will influence health behaviors. If you are in Western culture and your values encourage you to work long hours sitting at a desk and eat, processed food, that's going to be a difficult behavior to change. If your culture prescribes that you don't feed your baby colostrum, which is the first breast milk, because it's dirty or it's contaminated, then that's also going to have an impact on overall health. Changing health behaviors that are based on cultural beliefs is really, really difficult, and it needs to be done with sensitivity and respect. And a lot of times, it's really helpful to get champions within a culture or a community to become health educators for their own community. So an example, if we have Maggie, and Maggie has a family history of diabetes, but she also prescribes to the overall American lifestyle of watching TV for many hours and sitting at a desk for many hours and really not getting up to take a walk or doing any kind of formal activity program. And she's eating high fat, high salt, high processed food diet. She is at risk for diabetes. To change her behavior, we have to change a lot of the way she spends her entire day. And that's difficult. So we might need to provide a role model to her, somebody else who lives with diabetes and is successful at managing their blood glucose. So sometimes that peer support is really important. We can use mass media, we can use social media, and we can, as providers, be responsive, respectful, and use motivational interviewing, whatever technique we have. In low-income countries or more traditional societies, there may be health behaviors that are rooted in beliefs, and these behaviors are harmful. So, for example, you have a mother from Somalia, and she is expecting a child, and she's been told not to take the prenatal vitamin that has been prescribed for her, and not to eat too many calories because the baby will get big, the childbirth will be obstructed, and if she goes for a C-section in the United States, she will become infertile. So if you live with a population of Somali refugees, you need to be aware of those types of beliefs and behaviors and have a plan to address them. Other countries have problems with insufficient breastfeeding. They may have taboos about breastfeeding in public. And where that's the only infant source of nutrition, there are regions of the world where babies die from malnourishment because of improper breastfeeding practices or taboos. You can't feed the first colostrum because it's dirty. And so they don't, and their milk doesn't come in as fast. So they start to supplement with water or juice, and that interferes with nutrition, milk supply, electrolyte imbalance. And so we see stunted growth and poor resistance to infection later on. There are many, many examples that we could use to address cultural behaviors that we can target for change. And how do we do that? Oh, I'm missing a slide. Hold on, I will get back to it. There we go. Okay, so how do we improve health behaviors while maintaining cultural humility? Well, we start the way we start anything in nursing. We start with assessment. We need a careful assessment, one that gathers data from the members of the culture themselves and gets their input. One where we can prioritize what is important to this culture or this group. And one that also assesses social determinants of health, things that are outside individual people's control that need to be addressed on a more systemic level before we can get to that behavior change. If people can't access clean water, it's really no good to tell them, to drink more water. And they don't have access to fuel to boil the water. So social determinants of health are really important. What are the barriers to better behaviors? Another key thing to do whenever you're dealing in public health is to involve the community. They really need to drive the efforts. Community education is important, and getting leaders involved in that education is really critical, because if you come in as an outsider to a community and you really aren't a member of that culture, you're never going to understand it the way the members of that community do. So you need to get participation from other members of that culture. You need to assess the impact of the change that you're trying to make on cultural identity and socioeconomic status, and carefully tiptoe around that to make sure that you are not being disrespectful, and that you are not in some way destroying a piece of that culture. So really assessing the impact that your change is going to have. For example, if one of the things you're going to do is to build up roads and infrastructure, be careful that you're not trespassing on a lot of farmland, that you're not deforesting more, and really kind of impacting that way of life for people. Increasingly, you're seeing globally the use of mass media and social media to influence health behaviors. And this is really important. Mass media is more accessible to a lot of people around the globe, and social media, almost everybody has a cell phone, even in very poor countries. And SMS messaging, text messaging, automated messages to people can be one way of providing that health education. Sometimes public health agencies will use cash incentives to promote behavioral change, and that's really not so unusual. We do it here too, in terms of a discount on your health insurance or reimbursement for a fitness center. But sometimes people will get cash incentives to promote that behavioral change. Legislative and policy issues. If you have systemic barriers, you're not going to make a lot of inways, no matter how much education you do with people. So an example of this that I'm going to use is female genital mutilation, or female genital cutting. Some people are calling it more. It's a traditional practice. It's been in existence for over 2,000 years, but it causes many, many health issues and psychological trauma. And it's part of gender equality. It can cause obstructed childbirth. It can cause infections. It can cause bleeding and death. It's often done to girls when they're very young with no anesthetic and unsanitary instruments. Um, and there really is no good reason to do it. So this has become a human rights issue. One of the ways that people have started to decrease the rates of FGM is with legislative and policy issues. But in some countries, law enforcement really is not as effective at dealing with it. And so the community involvement was really important. The first change that was made was that there were safe spaces for girls to go to, for people to bring girls if they did not want them cut, where those girls could live and be safe from the community members who really thought that this was an important practice to promote chastity and virtue and just, improve the girls' chances at marriage. So there were safe spaces for them to come. That was the first change. And then champions started going into communities, talking to community elders, talking to boys and men to give peer education on why this practice was harmful and not helpful. And so there has been a decrease. It still exists. But then there were mass media and social media campaigns that drew attention to this issue. And so you did see a decline in the rates, although there are still a lot of room for improvement there. All right, we're going to end here for a little bit and pick up on immigrant health.